Welcome back, everyone. Today we're doing a deep dive into something really practical for your health cholesterol blood tests. And we're looking specifically at local info using a great guide called Cholesterol Blood Test in Hinckley, your local guide from the Blood Test UK website.
That's right. And our goal here is simple, really. We want to cut through the medical jargon.
Yeah.
And just pull out the key reasons why keeping an eye on these numbers right where you live is so beneficial.
Okay, let's break it down then. Big picture. What is this test actually telling us, and why should you care about it for keeping your heart healthy?
Well, when you get tested, it's usually what's called a lipid profile.
Right, not just one number.
Exactly. It's more detailed than just a quick total cholesterol check, though that's useful too. This profile looks at a few different things in your blood.
So what are the main players in that profile?
Think of it like this. You've got different types of fat carriers. LDL, that's low-density lipoprotein. It's often called the bad fat.
What?
Because too much of it can lead to buildup, like plaque, inside your arteries. That raises your risk for heart problems down the line.
Okay, makes sense. And the good fat.
That's HDL, high-density lipoprotein. Think of HDL as the cleanup crew.
Okay.
Its job is basically to grab that excess bad fat from your blood and take it back to the liver to be dealt with. So more HDL is generally better.
So the big benefit here is really about prevention.
Yep.
Getting tested gives you that early heads up.
Exactly. High cholesterol usually doesn't have symptoms you can feel.
Right, it's silent.
Totally silent.
Yeah.
So this test is how you find out if there's an issue before it becomes serious. It could be a real wake-up call.
Yeah, a motivator to maybe eat a bit better, move a bit more.
Absolutely.
Yeah.
And speaking of regular checks, how often should people be doing this? Generally, for healthy adults, the advice is about every 4 to 6 years.
But not for everyone.
No, definitely not. If you have other risk factors, maybe heart disease runs in your family, or you have diabetes or high blood pressure, then you'll need testing much more often. Your doctor will guide you on that.
Which brings us neatly to the local angle. The source talks about Hinckley specifically. Where can people actually go to get this done in the area?
Yeah, the good news is it's pretty accessible. The article mentions places like the Hinckley and Bosworth Community Hospital, Springfield Medical Center too.
And pharmacies?
Yes, and increasingly, local pharmacies are offering these tests as well, which is really convenient.
And having local doctors or pharmacists helps you understand the results, right? They mention the units.
Moles per liter, yeah. Just how we measure it here.
Sure.
A local expert can look at your specific numbers, LDL, HDL, triglycerides, the whole picture, and tell you what they mean in context. You know, what's good, what might need attention.
Yeah.
Generally, you're aiming for total cholesterol under 5 millimole, but it's more nuanced than just one number.
Okay, that's helpful context. Now, about getting ready for the test. Preparation, you need to fast, don't you?
Yes, that's really important for getting accurate results, especially for triglycerides, which are another type of fat measured.
Why fasting?
Because what you've recently eaten directly impacts those triglyceride levels.
Yeah.
So to get a clear baseline reading of what's normally going on in your body, you need to avoid food. Just water is okay for usually about 9 to 12 hours beforehand.
Got it. So planning ahead is key.
Definitely.
Okay, let's wrap up with the action steps. The source talks about improving your levels. What helps?
Well, it often comes down to those lifestyle basics we all kind of know, but they really work. Eating more fruits, vegetables, whole grains, cutting back on saturated fats.
And exercise.
And movement, yes. The recommendation is aiming for about 150 minutes of moderate activity a week. Things like brisk walking, swimming, cycling.
Doesn't it have to be super intense?
No, not at all. Moderate activity is great. It actually helps your HDL, that good cholesterol, work more effectively. It helps clear out the bad stuff.
So the final thought here. Since you genuinely can't feel high cholesterol until, potentially serious damage is already happening, this simple test is really the only way to know your status, to get the facts you need to protect yourself.
It really is that crucial window.
So thinking about that, maybe the question for you listening is, what's one small change, just one thing, maybe adding some berries to your breakfast or taking a quick 10-minute walk today that you could commit to, knowing how much this matters?